Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right. Because change is here, and it's starting with us. Welcome to the revolution. Welcome back to the Kind Revolution podcast. Today, I have my partner in crime, Kelly Salas, the Associate Medical Director here at Kind Health Group, and she's a family medicine physician assistant. And I'm a family medicine physician, and we are going to talk a little bit today about what exactly family medicine is, what we do, and how awesome our specialty is, and kind of clear up some questions for people about what it's like to be in the family medicine space. So, hi, Kelly.
Hi, thanks for having me. This is something I'm really passionate about because when I talk to family and friends about what I do, they're kind of like, oh, like where I go when I have a strep throat or where I go when I'm sick, or my only doctor is my gynecologist. Do I need one of you? And the answer is yes, you do need somebody who is your primary care physician and practice, who's going to take care of you in a more continuous manner so that when something does go wrong, you're not calling your gynecologist for a lump you found in your abdomen. You know, you're coming in to see us. We already know your history. We know your family history. There's trust. There's no embarrassment. And there's just a background knowledge. And I think you don't get that in other specialties. And you certainly don't get that in an urgent care setting, which I think is where a lot of people think is appropriate for them to be getting their regular care. So family practice allows us to take care of you when you're sick and prevent you from getting sick and keeping you well. It's kind of start to finish, mainly focused on prevention. Is that the way you think of it?
Yeah, absolutely. And I think the other thing too is it's the only specialty where we're trained to treat and see and understand the entire human lifespan. We see tiny infants, and we see kids, we see adolescents and teens and young adults and people in middle age and people all the way into their advanced elderly years. And so that gives us so much perspective about the human condition and the whole, it gives us a lot of psychosocial context on what's going on in people's lives. We see patterns that drive long-term health and suffering. And the cool thing too is we get to see generations of families.
I
And
was just going
so
to say that's my favorite when you get
it
the
is
grandbabies coming in.
yes, yes, we see grandkids and their parents and the grandparents. And so that gives you a whole new perspective on what's going on for patients and their families. And so much of it is just interconnected. And I think that's such a unique privilege in our specialty to have that vantage point on people's lives and to see them through everything, the good and the bad.
Yeah, absolutely. You've seen them on their best days, you've seen them on their worst days. And I think when you're when you're relying on more of like the emergency department or urgent care or, single specialty physicians to care for you, they don't know the background. They may just be seeing you on your worst day. There could be judgment going on, because of the way you may be behaving on that day. Whereas if you're heading to your family practice provider like us, we saw you through your mother's breast cancer. We saw you when your kid was in the hospital and it was the scariest day of your life. We saw you when you first got pregnant. We're the ones who probably told you were pregnant. All these kind of life milestones that we go through when you're with primary care and family medicine. It really helps to build the trust and overall kind of like continuity that I think leads to a healthier population. That's our goal, of course.
Yeah. I think the other thing too that we see a lot of in family medicine that people don't quite realize is mental health care. In fact, mental health is the family doctors, and not just family doctors, but most primary care doctors are really the de facto mental health specialists for the whole country. 80 to 90% of mental health is addressed at the primary care level. And I think a lot of people don't realize that. And so that's another big role that we play.
That is. And I think what we were just saying regarding trust, it's where people feel safe to bring up their concerns of potential self-harm or just, why am I crying every day? Sometimes they're actually crying when they come in for something silly, like an ankle sprain. They end up kind of mentioning, or sometimes because you know them, you identify this problem and they feel safe to discuss it. As family medical providers, we're not only trained in diagnosing it, but also seeing those early signs before a patient may even realize that they have a psychological or mental health diagnosis. And then, of course, we're trained in all the different treatments that are available. And something that I think is very specific to primary care and family medicine is that mental health, it affects every other body system and vice versa, right? We know that the cardiovascular system and the brain it's all linked, right? And so in family medicine, we know how to diagnose the mental health problem, the cardiovascular problem, and then at that intersection, find treatments that are actually going to improve both. There's been many articles published in journals that are documenting this correlation. The Journal of the American College of Cardiology reported on this strong correlation between mental health and depression and found that, I'm going to quote them, that depression increases the risk of myocardial infarction or heart attack by 30% and stroke by 45%. So if we know that we can treat a patient's depression before they even show signs of cardiovascular disease, we can reduce their risk. It's not just that treating depression is going to help their heart disease, it's that keeping their mental health stable is going to prevent heart disease. And so that can only happen in a place like our clinic where we do family medicine. We're not just here to treat one thing or the other. We're looking at the holistic picture and how they intersect and intertwine with each other.
Yeah, that's really powerful. I didn't know that statistic about depression and heart disease.
Yeah,
Yeah,
it's actually more pronounced in women too.
of course.
Yeah, I think a lot of the stressors, there's just so many different responses that go into place with psychological stress. And yeah, and women are even more likely to have those cardiovascular outcomes when they've been diagnosed with depression and PTSD. When you're going into an urgent care and emergency room with symptoms of either cardiovascular disease like chest pain or mental health symptoms like thoughts of self-harm, there's nobody there who's kind of creating that picture for you of the importance of kind of treating each of them to help each other. And then they're also not offering any long-term solutions that are going to help to prevent and treat this patient moving forward. So again, having that family practice provider is going to help you, maintain your mental health, maintain your cardiovascular health. So hopefully our patients will never end up in the emergency room. That's our hope, right?
Yeah, exactly. And yeah, that is so true. I think the other thing too is getting back to the way we approach women's health, I think is also unique because we are looking at so many different aspects of women's health, which is very complex. Not that men
Yeah.
aren't complex, they are too. We treat lots of men, but our area of I think focus is particularly towards women and kind of looking at those life transitions and how they impact your mental health and your physical health and hormonal health and metabolic health. And we come at that from such a comprehensive viewpoint so that we can really sort of tease out what might be happening. Whereas if you kind of go into one siloed specialty, they're really going to only be looking at one narrow aspect of what's happening in that moment in time, in that, in that difficult time in your life. And so I think we're uniquely positioned to have that better perspective. What do you think?
I couldn't agree more. I think that, having practiced for just about 20 years and knowing women through various decades of their lives, it has I've actually learned a lot just from watching, the way women go through these decades, the different type of things that they're going through and the way that their risk factors are changing for various things. We know that women are more likely to be diagnosed with mental health problems as they're going through perimenopause. And that also happens to be when your risk factors for cardiovascular disease go sky high and whatnot. But if you're somebody who doesn't have a primary care provider, you may not even know where to go because you're thinking, you're not even sure how to identify what's going on, right? Should I go to a cardiologist for this palpitation that I'm having, or should I go to a psychologist? Maybe it's related to anxiety. Without having this central hub of a family medicine provider, you really don't know what is what and what's causing what. And we know, for instance, like a woman with some mood instability, she may actually be diagnosed with depression and started on an SSRI before even being evaluated for hormonal changes, right?
Yeah.
Or
And we see
on the
that all
other
the
hand,
time. Yeah.
you could have a woman who, looks on Instagram, finds herself a hormonal provider, and maybe she actually has a diagnosis of major depressive disorder. And she didn't get the help that she needed because sometimes hormones are not enough to treat that, right? So having this kind of, I guess, the continuity of care and having the comprehensiveness that occurs in kind concierge and family medicine in general is, I just think it's almost like an asset. It's this valuable tool that patients can have in their lives that help to kind of help them understand their bodies better and their minds better.
Yeah. I was also just thinking too, kind of the flip side for people who are really sick, helping them navigate the healthcare system, which, as we know, is completely broken
Yeah.
disaster. And even as healthcare professionals ourselves, it's very hard and challenging and scary to think about how to get through some of it. And I think when patients are in those very deeply vulnerable positions. Like, I had a very close friend of mine who was diagnosed with stage 4 ovarian cancer yesterday and just completely at a loss and like where to go next. And that's something that, again, I think we're uniquely positioned to do. We can help people walk through those times that feel so lonely and terrifying.
It's true. And I'm so sorry to hear about your friend. I just think she's so lucky to have you, number one. It's a gift that you don't even realize that you have, right? She's your friend. You're going to care about her and everything no matter what. But you also have this primary care medical doctor training that allows you to really think about next steps. And I'm sure it was very reassuring to her when you were able to discuss with her the results and create a plan. Patients always feel better. Patients, friends, family, everyone feels better when there's a plan in place. And so that's not necessarily provided by a specialist who is only thinking about that one specific cancer in this case. Really, you're able to look at her in a more holistic way and ask her how she's doing, right? How is she
Yeah.
coping? What is her support system like? I am proud to say that at our practice, I think if somebody were to ask one of our patients, what's your support system like? We're going to be like on that list along with family members because we can provide that support. And honestly, a lot of the times we are even supporting the family members themselves because it's
Yeah.
overwhelming to anybody without medical training. So it's almost like having this like secret weapon in your back pocket, which our friends and family have thanks to knowing us. But most families don't have that. It's like, isn't there a saying about like every family should have a doctor and a lawyer and like an accountant or something? Not every family has a
Yeah.
Dr. Nanos and a Kelly in their back pocket.
I know. The other thing too that I think patients right now, there's so much hype about longevity and biohacking and anti-aging, and really that's what long before longevity and expanding your lifespan became so trendy. This is what family medicine has always been. This is really just family medicine 2.0,
That's
something
so
that
true.
right.
Yeah.
I mean, because family medicine is about prevention. It's about helping you modify your lifestyle, doing everything you can to lead the healthiest possible life. So this is just more of what we've been doing. You're welcomed at world that, we're finally figuring it out. We've been doing this a long time and now, we're kind of elevating it, to taking it to a new level. So I'm glad everyone else is on board, but it's something we've been
Yes.
doing for a long time.
I
And
know
we've
it
got some
seems like
pretty,
there's more and more tools that are becoming available, but it's still the same goal. It's still the
yeah,
same goal of having patients feel well, age well, essentially, right? Not just get to a certain age number, but also to thrive in each decade, whatever that looks like for them and whatever their goals are. We've always been doing that. It's true.
yeah,
But now it has a fancy tagline and
I know.
and we
It's
do have
very,
more exciting tools that we're able to use to help them get there and to help them understand and visualize
yeah.
how we're helping them get there.
I'd say my two favorite ones are the GLPs and the Gallery tests. I think it have been game changers.
Total game changers. I couldn't agree more. I myself am surprised pleasantly about the different ways that I've seen the GLPs improve patients' lives and provide that longevity that they're seeking. not just in obviously, not just in a vain way, but I've had patients who are suddenly able to take part in the exercise programs that they took part in when they were like 30 and now they're 60 and they're able to, hit the gym confidently because they weigh 30 pounds less, their knees don't hurt. And it enables them to just take part in all their family activities that they always enjoyed, but now they're just more mobile and more confident and just seem to be all around healthier. And I just know that's providing that longevity that patients are looking for. And they want to have, you know, they want to have good life in their years, not just grow old and accept things.
Yeah. All right. Final thoughts, Cal?
Well, my final thoughts are just that I want anybody who's listening to go out and make sure that they've got themselves a really genuine, authentic, well trained, and fantastic family medicine doctor to take care of them, whether it's us here at Kind Concierge Care or in their own state and city. It's an important part of your care. You may not think it right now, but you will not regret it.
Yeah, I totally agree. Brings everything together to have someone that's just looking at the whole picture, and it really it is the way to really optimize your health, I think, in the most efficient way too. You don't have to go to a million different people. So if you got one person that really knows what they're doing, that
That's a
saves
good
you
point.
some time too. So all right. Thank you.
Thank you for having me.
Thanks for joining the Kind Revolution. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is the Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter one conversation at a time. Thanks for joining the revolution.